Hi, my name is Jamie Riddell. I'm a neonatal nurse practitioner with Seattle Children's Hospital, and I've been working here at Providence since 1996. I started as a LPN and just worked my way up through the ranks. So I've done everything from LPN to RN to nurse practitioner. I understand that education really helps us do a better job, and so we really want to talk today about the late preterm policy. Babies are very likely to have hyperbilirubinemia. Jaundice is much more common in the late preterm baby, and it's heightened by the fact that the hepatic and bilirubin conjugation pathway is immature, just like the baby is. Can also add on to that poor feeding or dehydration and weight loss, and you have a recipe for readmission for jaundice. So making sure that those babies are screened early on and knowing what the risk factors are, including the maternal risk factors, baby risk factors, and any previous children or siblings who had issues with jaundice. If you have a mother who's had 2 other kids who all required phototherapy, it's pretty likely that this one will also. So having early intervention for those things is really important too. Oftentimes it's helpful to follow up those jaundice levels early on, 18 to 24 hours, and if it's looking like that baby is already becoming jaundiced on that hourly Billy nomogram, the Butani nomogram, you can intervene sooner than you would had the baby been an outpatient. For example, if the jaundice level where you would start phototherapy is 10 and the baby's Billy is 8, you might start phototherapy early. Up in the mom's room, you're able to monitor her feedings, monitor the jaundice, and really help get that jaundice level down and still have them go home in time. So those are all things that we would consider for a late preterm baby that you wouldn't necessarily do for a term baby, expecting that they would be able to conjugate their bilirubin more maturely. Another risk of the preterm baby related to jaundice is their immaturity of their blood-brain barrier, which also has a decreased free albumin, which attaches to bilirubin. With all those risk factors combined with poor feeding and dehydration makes the risk of severe jaundice or kernicterus much more possible, which is why we have a heightened level of monitoring and need for surveillance for these babies. Making sure we know what their jaundice level is and what their rate of rise is very important. So you can expect to see requests for a jaundice level within 18 to 24 hours, and then a follow-up jaundice level before the baby goes home, or even within 12 to 24 hours. This will help us determine rate of rise. If you have a baby whose rate of rise is more than 0.2 milligrams per deciliter per hour, you probably would want to start phototherapy. If you have a baby whose jaundice level is anywhere near the phototherapy level while still in the hospital, that baby's going to be staying for phototherapy. This will just prevent them from having to go home, become even more dehydrated, heightened risk for severe jaundice or kernicterus, and come back much more sick. Education is key, so preparing the family for follow-up after discharge within 24 to 48 hours, depending on what that jaundice level is. They can go to their pediatrician, they can go to the postpartum follow-up clinic, but really need to be seen within 24 to 48 hours. So having them be aware of that early on will help them to have time to make an appointment and make sure that they're not getting missed or slipped through the system. The other thing that's really important is to educate them as to the signs and symptoms of worsening jaundice or kernicterus. While I don't necessarily recommend we scare everyone with the idea of kernicterus, it is really important that people understand what the risks are and knowing the signs and symptoms that the baby is getting sicker or has a higher level of jaundice. And while you review jaundice with your families every day, to reiterate what those signs and symptoms are of worsening or significant jaundice. A baby who just really isn't waking up for feedings repeatedly in a row, 1 feeding is okay, but 2 or 3 in a row, if they're just really not able to wake or stay awake for feedings, is concerning. Obviously looking at the whites of the eyes, if the whites of the eyes are starting to be yellow, that's more concerning. The gums will actually start to turn yellow, and then you can show them how to blanch the skin and look for jaundice as well. A baby with severe jaundice goes from being really sleepy to being very irritable, difficult to console, maybe arching or has a really high-pitched cry and doesn't stop crying. Those are reasons to get to your doctor right away.